Hello, everybody. Welcome back to Partners in Promise's Trust Your Gut series. We are here today joined by Dr. Jeffrey Katz, and we're thrilled to have you. Welcome to the program, Dr. Katz.
Thank you. I'm glad to be here.
Yeah, and Dr. Katz is joining us. He
Great.
is a clinical psychologist from Virginia Beach, which is, as many know, a very military dense area of the country. We have the Navy base over
Yes.
there and others. So, Dr. Katz, can you tell us a little bit about your connection with the military? I know that you obviously serve a lot of military clients in your practice.
Yes. I've never been in the military myself, so I can't claim that. But this area, and I grew up in Norfolk, Virginia Beach area, so it's always been very highly military. You know, there's a naval base, Oceana Naval Air Station, there's Langley Air Force Base, Army bases all over. NATO headquarters is here for the United States. So anyway, there's a lot. But in my practice as a psychologist, I see primarily children, adolescents, and families, also some adults. And I do a lot of work with schools. I do a lot of advocacy in the schools too. So I see probably 3/4 of my practice is probably military. Because I have a niche in ADHD, I don't actually accept insurance except for TRICARE, because I know that if I didn't take TRICARE, officers maybe can afford, but not enlisted men or men and women. So it's important to me to be able to serve the military in that way. But being in, around a lot of military and talking to families and being in contact with different departments that I have to be in contact with, I've learned quite a bit about the military.
Yeah, well, thank you for doing that, and obviously for the locals in your area for accepting TRICARE, because as military families,
Yeah.
we have a hard time sometimes like getting plugged into quality care. And so one of the things that our series today is talking about is kind of the giving families the tools that they need to understand a little bit more about those feelings in their guts. If they observe something in their child, they wonder, maybe it's their first child, they don't have a barometer or a measuring tool to help them understand, like, is this something that's related to my PCS move, the stress of the deployment? So, obviously you mentioned your specialty area is ADHD. We would love to kind of hear a little bit about your experiences either with the military community in that area, when a new diagnosis, things to
Yeah.
be looking out for. Do you have any frequent situations that you can expound on?
Yes. Yeah, I'll try to. So, first of all, there's a difference between when I'm doing an evaluation, trying to do a good evaluation on someone, but there's a difference between that and then what brings somebody into the office or what keeps somebody out of the office.
Mm.
And it can happen both ways. But so I see kids and, down to whatever, age 2 if necessary. And teenagers in school, and that is where kids supposedly go every day, but are involved in all the time. And so things that might not have been much of an issue before, things can get handled at home okay. Kids go to school and then they may start having issues, or particularly with ADHD, if the kid has a good IQ, they can do pretty well in the first 2-3 years. But then like the 4th grade, 5th grade, when you're not learning to read anymore, you are now reading to learn. Now we have work you have to do, a lot of organization and an expectation of more independence in what they're doing. Then you often see a lot of difficulties start up at that time. But when parents call me, first of all, I need to respect that their calling means that they have a concern. And that's always my first question: what's your concern? And parents will say exactly the kinds of things you're saying, that he's always been a little rambunctious, but he's a kid, and that's fine. And I've got 18 other boys, and but this one is a little bit different. So sometimes that's part of it, is that this particular youngster, it kind of there's something different about the quality of their rambunctiousness and whether they can turn it on and off, or the inattentiveness, those sorts of things. So I kind of put it also that parents have the long view of a child. They've known the child over the course of years. So they have that view of the child from being very little to as they're getting older. Now, if you look at teachers, teachers have the very short view. They have your child in that classroom, but what their expertise is that they've seen many kids, so they have a sense of at this age, this age range, what would be generally appropriate for that youngster. So they're two things that they're both very important things. So I say to parents, because sometimes the parent will bring somebody in and they'll talk and say, well, what do you think? Do you think the child has ADHD or might have a learning disability? And I usually say, well, and in my mind, it's like, maybe I do think so, but I want to do an evaluation. I don't want to make a judgment or a diagnosis just based on an initial sit down. And what I usually say is, well, I can understand why you're bringing the child in. I can understand what your concern is, that maybe they're not doing so well at school, or they seem to be bright enough, but they seem to be struggling with certain things, or maybe even socially. So for parents, it's really if something just feels off, to me, it's not a bad thing to have a child evaluated, particularly when you're younger, because then you have a baseline. If you have a concern, for example, when my younger daughter was like 2 years old, we just didn't think she was speaking much. Mm. We had an older one who was very verbal. And so we had her seen by a speech pathologist who came back and said perfectly normal, maybe a little bit above, but this is not something to worry about. But we, if you were going to do something for a child, the sooner you get involved, the better. The sooner you intervene, the better. And I think that's important for parents to know.
Yeah, that's hard for military families too, because it's hard for military families is because we transition a lot. So that's why, your expertise is so important.
And that is an issue for military families because they do transition. And I find that some military families build support for themselves pretty easily, other family or, so on. Some do not. Some families I see, they don't, if they're coming from out of the area, they don't have much of a support network, which can be very tough on families too. In military families, with the service, with the Navy, the service member goes on deployments. And they used to be able to count on 6 months. It could be 9 months, a year, they're very long deployments. Or even worse for the family when the ship is going in and out, doing training, dad's in for 2 weeks, then is out, for 3 weeks, comes in for 1. And that creates a lot of stress in the family. I think military families, the dependents feel like they should be able to take care of themselves and the family. And that's kind of part of that culture in the military, I think, is being able to take care of things. And I think that the spouse who's at home doesn't want the spouse out at sea to feel like they can't handle the kids, and which creates a lot of pressure. And if the child's not doing well for good reason, I mean, you need to check that out. But even if the child's not doing well because they're having trouble with it moving into this area, or the school system is different than what they're used to, and for any number of reasons, that creates stress. And also the stress of when the spouse comes home, or what are they going to say? And, sometimes there are all kinds in the military. I see a lot of kids who are the kids of SEALs. There's one of the bases is here. And the secret is that many SEALs have ADHD.
Yeah.
And
SEAL Kids is one of our partner organizations. SEAL Kids is one of our partner organizations. Yeah. Mm-hmm.
Okay. And many of the kids have ADHD. But, SEALs have certain training, and I mean, that's kind of what happens in the military. And really, it does happen, in my experience, I imagine, for the families. I'm telling you all kind of things you already know, that sometimes the spouse who's in the service is maybe a chief in the Navy. Their expectation, they have learned in their training that people do what they're supposed to do, or they do what you tell them to do. And kids just don't work that way. But that can be normal, right? So that happens with all of the kids, right? So, okay, most people are resilient and deal with that, and most kids do fine. It's okay. We're kind of talking about the kids who that's not working for,
Hmm.
that it's not working for what you would expect to happen. With ADHD, I had a parent tell me the other day, well, how would I have known that this was not normal? Because this is what I was like as a kid, or this is what he was like as a kid. What made me think this was not normal? But then as they learn about ADHD, they realize, oh yeah, there's a problem, and it was a problem for me, but and not necessarily that they were shielded from it, but it was a part of their lives. So that's also something.
Yeah. So what would those, so, you mentioned like, how would I have known? So are there any indicators that you would say would be something that would be a little bit outside the norm, or is it truly case by case? Because sometimes, as with all special education, everything is case by case. There's, different diagnoses, different levels, and all of that. So is there any kind of
Yes.
standard that parents can look to, or at least um, consider?
Well, like ADHD, and many kids with learning disabilities also have ADHD, and the reverse is also true. Um, so ADHD is a developmental disorder, meaning that the child is not, or as what's usually said is, he's not as mature as other kids his age. He's immature. He can't keep his attention on stuff. He's playing with little stuff. He's just not doing. And that's true because most people with ADHD are about 30% behind um, their age mates. Doesn't mean that they're not going to develop, but they kind of stay behind. So rule of thumb with ADHD, like with homework, is kids can probably handle about 30% of the homework, or I'm sorry, about 70% of the homework uh, as the peer, that they just can't handle, because of the focus, organization, and things like that. So one of it is developmentally goes along. So if your child is not seeming to do as well as they really should, it doesn't mean 30% in everything. I mean, it could be emotional control. Kids with ADHD also have emotional dysregulation often. So it's something that, and that's where you kind of look at teachers and say, if you're getting feedback from the teachers that he's not keeping his mind on his work. I always ask in a meeting, well, how he's doing compared to the other kids in that class, and you could ask that in a school meeting. How's he doing compared to the other kids? It could be, well, actually not that bad. They're all kind of like that. Well, okay. Why are we having the meeting?
Yeah. I wonder
you
in
know,
COVID, is that any, I mean, I wonder how that plays out with teachers and other observations. And again, we go back to, it's different everywhere. So in California, where I am, it's 100% virtual right now. And then in other areas of the country, it's this county is in person and this one's a hybrid, everything's a little different. So I wonder, have you
no,
noticed?
that is true. It's a challenge, and just now studies are beginning to be published about like kids with ADHD in the virtual setting. What happens, but that's something else. So ADHD, to diagnose it, you have to diagnose it in 2 of 3 situations, and that's home, school, and community, right? Because a kid could be really bright, be having trouble in school, or not having any trouble at school, but with soccer, you can't get, he's all over the place, you know. But it's so a good diagnosis of ADHD is really gathering information from different areas, from teachers, parents, coaches, other people may know the child well. Also, you need to get a good history, because ADHD doesn't generally just pop up. So if the child starts having big problems, just something happened, you really have to look at what happened. So, and not that sometimes that kid maybe didn't have ADHD, but something shifted in their environment that it's now coming out. But that's what a good diagnosis is about, is trying to figure that out. In most kids, if you ask a parent, when did they think that maybe there's something different with their kids, they generally will say around the age of 2.
Mm.
The terrible 2s came and stayed. It didn't go anywhere.
Ah,
So part of it is trying to get that long-term view, um, that it's more than just the transition. It's more than the move. It's more than just the deployment.
yeah.
There are changes like that.
So I mean, you mentioned the transition, and I know that that's something that is important, and especially either if someone's early in the stages of recognizing these symptoms, or how can parents kind of keep an eye out during those times for indicators, or obviously they're caring for their child, and so they're just aware of those stressors in their child to be able to just love them as a parent would. But are there
Oh
any
yeah.
tips and tricks that you would suggest for parents during transitional times when they're
I would have to go with structure, because moving, there's a lot of changes, no doubt. But so when you move, you want to get the house back together as quickly as you can. You want to get the routines back in time, about bedtime, about when kids can be online, when they can't, chores, what that pattern is. And with any, and not even just ADHD, but kids with ADHD are going to have a harder time with those things. But the structure is the kind of thing that holds kids together anyway. So for any kid, you want to get that structure in place. And then, because once you have that going better, then you again have your measure of how is a child doing. The particular child you may have a concern about, how are they responding again to the structure? Because you'd likely see the other kids settle in, but
yeah.
in this, the kid with ADHD or learning issue may have more difficulty with that.
So even when the structure's back in place, it's harder to kind of feel
That
like in a rhythm.
right. In other words, what you were seeing before, it's popping up again, right? What does that mean?
Yeah.
Um, so, and that happens here too. Families will move in, and for example, Virginia Beach school system is said to be, harder, or have higher expectations, they'd like to say. Um, so sometimes parents will give me a call about this, and they'll say, but it's a new school system, maybe it's just that. Well, maybe, but listening to them and what their concerns are, sometimes I'll say maybe it is, but it doesn't hurt to say to the school, I'm concerned about my youngster, I suspect they may have a learning disability, and get the ball rolling, or at least have a meeting so that there is documentation in this child's record that you brought this up.
Yeah. And so
Because he doesn't settle down in 3 months. You
you
need the school
mentioned
to do that.
meetings. You mentioned meetings. So it's
Yes.
one thing I know we wanted to talk about, as far as when you do get in an IEP or 504, meeting, and those, we call them a student success team, or whatever the terminology is where you are. What do you recommend as far as those early meetings for parents, especially with ADHD, of any best practices or things that parents should know?
Well, so one is, know what the terms are. So the student success team is not IEP, and it's not a section 504.
Yep.
It's essentially an informal meeting. Oh yes, well, we'll try some interventions and we'll see how they go. It's not official.
Yep.
The school, there's no contract, there's no obligation from the school to do anything. So now I'm not, I get down on schools, but I have to believe that schools want to do the best for your kid, and the teachers want to do the best. However, they may not understand the problem. They may not recognize the problem. And they also may not necessarily want to be responsible for working with it. So, I guess by the time a parent gets to me, and I understand that maybe some parents who haven't talked to somebody yet, but by the time somebody gets to me, I usually say, I would not do, student support team, because if you're concerned and they're concerned, call for an IP meeting, call
Yeah.
for, because you
Or an
want them to take
evaluation,
it
or
seriously.
going forward. Yeah.
Because you won't get an evaluation from student support. So, and you let the school know what your expectations are. I know in this area, you know, the EFMP program and the pediatric program at Portsmouth Naval Hospital used to have a military person who was really an advocate, and she was pretty effective, but there was only one. I enjoy what I do. Not all psychologists get involved with the school. They may write a note saying, I think he needs a 504, but in my perspective, that's not enough. There are some advocates in this area, and you know, the basics of having a meeting is to have somebody else there with you. I record every single meeting, and you have the right to record meetings. That's a federal regulation. And
each state does have, just so parents know, each state has different regulations. It's important to know your specific state. You're always allowed to record, but sometimes you need to give written notice that you will record. So just be sure to check your state laws prior to, at least give yourself a few days prior to give notice.
Yeah, and I true, and I also, you know, say to parents, you know, tell them a day before that you're going to record it. You have to know the terms. Talking to other parents, you know, Partners in Promise is a good place. There are other organizations like CHAD, and Children and Adults with Attention Deficit Disorder, that I'm highly engaged in. They have a lot of really good information there. And they have health information specialists if you wanted to call in and ask questions. They can't do the advocacy for you, but they can give you the information. But you have to educate yourself as much as possible. People in the service are, you know, you're trained to obey. You know, even if you were a kid, you've learned to, you know, listen to the teacher and listen to the principal. They know what they're doing. And you can't take that stance. You have to give an expectation that this is my child. And I understand that this is what he's entitled to. Yeah. So you really have to talk to people about things, having somebody in the meeting, having an advocate, and don't necessarily just take their word. Other things I do is if the school isn't responding, I find out who to talk to. So in our area, we have the special ed coordinators, and they each cover a group of schools. There were really compliance officers. Is the school doing what they're supposed to do? But I get them involved. So if you're not sure that the school is responding, call downtown and say, you know, is there somebody who oversees the school in special ed or section 504? Because I'm concerned that they're not doing what needs to happen. And you need to find out what people are doing in different areas. If your area says, well, we don't do that here, you know, if you have an IEP and you're coming in and they sit down for a meeting, it seems like this first thing the schools want to do is to change the IEP.
Yeah.
And you can say no. You have a working IEP, and these are the services, and he's just shown up here. I'm not changing anything till we have a few months to see how things are working. It's better to have things running well and then change the IEP, maybe reduce services or whatever, than to start poorly and then have a kid who's really frustrated and then try and fix things. So to me, you have to get information.
Yeah, that is true. And that's exactly why we're having this series, to give parents some tools so that they can understand what their rights are. And because state to state is different, county to county, school to school, everything is a little different, and it's hard to understand. So parents feel overwhelmed. So education is very important.
So one thing I'll say, it's a little different because it's still all under federal regulations. But there are some things that are different. The other thing I would tell parents all the time, and I do too, is when I am really not sure about something the school is saying or doing, or something's happening, I call the State Department of Education, the State Department of Education, Special Education Office, and then it's called the Dispute Resolution Office. And you can call them. Anybody can call them and say, look, this is what's happening. Is this the way it's supposed to be? And sometimes they'll say technically yes. And so like it's not, you can't file a complaint on that. Technically yes. Sometimes they'll say, no, would you like us to call the school and talk to them about this? Yes. or they'll say this, again, they're not going to advocate for you, but they'll tell you what the regulation is,
Yeah.
and is what the school, does it make sense or not, and where we need to go with it. Call the state, find
Yeah.
out what the state says about it. That's what you do.
Yeah. And I mean, as parents, it's as military parents, especially if there's a deployment going on, sometimes those things can feel overwhelming to begin. But once
Yeah.
you get going and you become more familiar with the language and the terminology, like you said, it becomes easier and more accessible to parents. And so, we have on our website, we have a huge list. We call it the ABCs of special education. And we have a section that talks about special education, one that talks about military terminology in special education, one that talks about legal terms. And so there's a lot of resources that we provide, but organizations like CHAD and all the other partners we have can get you started. It's not easy, but it's at least a starting place.
Right. Yeah. And honestly, nobody's going to come in and take care of it for you. As a parent, you're the child's best advocate, and you do, nobody's superhuman, but you do what you can. And I always talk about, letting the school know what your expectations are, and that is going into a IEP meeting or a 504 meeting, and if you're not walking out feeling really satisfied, like, I don't know, don't sign anything, get more advice,
Mm,
talk to somebody. I just
yeah.
think it's so important. And unfortunately, it's a cottage industry out there. There are people who are advocates out there, and there's no certifications.
Mm,
So you really have to talk to people.
yeah.
With CHAD, it has, I think, 200 chapters around the country, and there's one in this area. Um, Go to a CHAD meeting. They're
Mhm.
online. And ask people, who do you talk to about school issues, and who do you go to? Or through the military, the EFMP program, or some of the, I'll say, the pediatricians at the Naval Hospital, because uh, there's the TRICARE clinics,
Mhm.
but a lot of the people move in and out, so
Yeah.
it's hard to get ongoing care. But I imagine in this area with TRICARE, um, for the most part, 95% of the time, mental health, you have the right to go outside of their clinics, the
Yeah.
TRICARE clinics, and you can go to a physician, you can go to a psychologist, or social worker, and of your choosing. Occasionally, they'll say that you have to get permission to go, but
Mhm.
I think there are ways to get around that, not around it, but to get through that,
Yeah.
so
Yeah.
that you get the help you need.
And you can always, Military One Source has counseling, at least advisors that you can call in and ask what is covered and what isn't. And it's not through your primary care doctor. And even if you are on
Right.
TRICARE, where you're paying out of pocket to see, non-military facility, you can still call in to Military One Source and get a counselor on the line, even if it just ends there. But you can ask what resources are in your community and they can plug you in. But also, when you
Yeah.
were talking about advocates, if you read Partners in Promise, we know a lot of people throughout the country, and we definitely can help point you in the right direction. So if you are looking
Yeah,
for
I
an
didn't know that.
advocate, a good option as well. But if you don't know where to start, or you're new to an area and you don't know who to talk to, feel free to reach out to Partners in Promise and we can
Yeah.
help connect you.
And I would like to say that I wouldn't want any of the parents listening to feel bad about doing these things. It's about your kid. So one of the things that's important to remember is that kids want to do well. Kids kids want to be liked by people. They want to be loved by their parents. If a kid is not doing well at home or at school, to me, there's something something's getting in the way. Something's missing. There's a
Mhm.
skill the child doesn't have, or something's happening, like a kid with ADD. They, oftentimes they'll get put on medication, and whatever the oppositional behavior was the parent was concerned about, they don't seem to be so oppositional,
Mm.
because the kid always wanted to do well, but couldn't regulate themselves to do well.
Mm.
So, as a parent, if you see your child not doing well, they're not going to be happy, and sometimes they show it because they're more angry. To me, that's a sign that it's not your fault, parent. It's because something really is going on. and that's where it's maybe time to get that assistance to sort that out and to understand. Of course, your kid wants to do well. Who wouldn't want to?
Yeah.
Yeah. And I think that's important to remember.
Yeah, they just need the tools to succeed, and that's where parents we come in to observe. As we're not experts, but we are experts in our children. We're the ones who know them best, and so we don't have to be medical professionals to understand our own child. And so that is the thing that we have that others don't have, is that, like you said, the length of knowledge and the breadth of knowledge of how you know your child, especially with COVID when you're possibly with them all the time. And so thank you for these insights, Dr. Katz. Do you have any last anything that you would like to add to this conversation? You've said so many wonderful things. I can't wait to watch it again.
I thank you. One thought I had was that different from other families I see, so there's a lot of different kinds of people. They come from all over the country, from cities to farms. I'm always interested where people come from. I look up these tiny towns that people may come from, and that's a good thing. And people who are in the military, that's a positive of really meeting other people in other places to live and other ways of living. But many people who come, there's pressure, right? There's stigma about mental illness, about ADHD, learning disabilities, depression, anxiety, and coming from a small town or more of a close-knit group, it may be hard to. One place that maybe sometimes military families get a little concerned is that they may be here, having a life here, but their parents and the rest of the family is back home. And what will they think about this? So I'd say overcome that. Remember, it's for the child. That's what's important. It's your child. It's something we need to do.
Yeah, stigma is a big deal in the military, and it's something that I think by having these conversations, by talking about this, by making it more accessible for families, especially we're hoping that families who are not yet diagnosed will benefit from this session and the other sessions we have for the month of the military child, because it is all about education. You don't know what you don't know, and it's important as parents to educate ourselves about our kids and to take what we see and those little moments, those little feelings in our head or in our gut, and measure them against fact, because we can't always know, but we are our child's best advocate. So thank you so much for your time, Dr. Katz. I appreciate you coming on today and sharing your knowledge. Hopefully, if between this wonderful conversation and that, you can get some starting points to know if it's appropriate to go reach out to your pediatrician or making next steps at your school district. So thank you. Thank you again for your time, and keep tuning in for the rest of our series this April.